many
Maybe it's
companies.
Oh.
I just ignore them.
Those are false advertising, right? You're saying? Exactly.
And it's
Yeah.
ridiculous.
There are a lot of companies.
People that go ahead and make a checkout for them and send it in. I don't do that.
You know what I would do if I were you? Make a pile of those and get somebody to take them down to Chris Carney's office and say, can't you do something about this? You know, they're really targeting older people,
That's what it's.
and they're targeting people that might not be aware of all their choices under the new law. And for one thing, people in the donut hole are being told by some companies, give us your money and we'll make sure you get your reimbursement. Well, no, the check comes automatically. They were even doing robocalls, automated phone calls, machines calling people, saying, send $10, send $20, and we'll get you your check. You don't have to do anything to get that rebate check this year. That $250 comes automatically. It's the same thing they did with the Social Security rebate, last year or the year before? There were companies out there saying, I can get your check for you faster. No, you can't. The check's going to come automatically. That's crazy. Do you have an email? Did you put your email down there? Yeah, I'll send you the information. You can also go, there are a couple of websites you can go to if you want to write these down. Healthcare.gov is the new federal website, and that just started last week, so that's why I don't have it on the literature yet. And then our website is at the top of that sheet you have. So you know they're going to make sure that there are some good options in there. And basically it's going to be like if you had employer-based insurance before, your employer had kind of a menu. You could choose a high deductible plan or a high premium plan or whatever. But you've got a choice of maybe 2, 3, 4, 5 plans. That's the way the exchange is going to operate. So for your adult children that aren't on Medicare yet, that's what they can look for. And the other thing is, I don't know if any of you have ever run into this, but on private insurance, there will be no more annual caps. There used to be, for a lot of people, an annual cap, maybe $100,000 to $500,000 a year or something. If you have heart surgery, you're over that cap. You're paying out of pocket 100%. There are no more annual caps, and there's no more lifetime cap. I know for most of the time I was working, and had now even insurance through my work, it's $1 million lifetime, which sounds like a lot of money, but you have 4 heart surgeries, and that $1 million is gone. So I hope he was on Medicare when he had that heart surgery. So there are no more lifetime caps because the government realizes that healthcare costs have gone up astronomically. They want money, right, that's true. That is true. Any other questions?
Yeah, there's a question that's been asked around. What is this $250 stimulus program that we're supposed to get money?
So that's the Medicaid, that's the donut hole rebate that I was talking about.
Is that the one?
It's not stimulus money.
What is the stimulus money?
That I don't know about. There was stimulus.
David, what is it?
No, I heard that they're supposed to give out a $200, not $250. I heard that they're supposed to give out a $200 stimulus check.
I heard 200.
And
the money's in place and it has to be put out by September.
I'll look into that too.
Yeah, because
remind me to follow up on that.
It came from a good source that I know of.
Is that for Social Security recipients? Is that the idea?
That's for Medicare recipients.
Medicare recipients. I think it's mixed up with that $250 donut hole rebate myself.
No, it came at different times. I don't think so.
Yeah, because the minute you hear you're going to get a check, you want to see it right away.
Oh, yeah.
I don't blame you.
Didn't we get a check a couple of years ago for $200?
So,
I know we got a check.
I don't know if you all heard this during the debate. I think most people do. The whole idea that there's going to be death panels, and they're going to try and pull the plug on grandma to save money.
So we would
Did you all hear those rumors going around? No, maybe I shouldn't mention that.
Just trying to boost the economy.
But a lot of people in Congress were getting calls, and I went to some town halls that David was at some too, with Chris Carney, and people were standing up and saying, you're trying to take over, and make me die early or something. But all that's in the law is that you are guaranteed that your doctor will be paid to have a conversation with you about what kind of care you want at the end of life. And for me, this became very real to me last year because my husband has a form of dementia that's not Alzheimer's but is progressive. and then he had congestive heart failure. And so, you know, his worst fear is not dying. His worst fear is, you know, lying in a nursing home somewhere drooling and not being able to do anything for himself and having somebody change his diaper. And, you know, it's a very real fear, I think, for all of us. None of us wants to go out that way. So what the healthcare law says is we need to talk about those issues openly and tell your doctor, you know, have a conversation with your doctor about what you... So what this law is going to do, it's going to force doctors, you know, it's going to take a hard look at what these doctors are doing. You know, are they just, because a lot of doctors now, they own their own equipment. They own an MRI center, or they own a colonoscopy center, or something. You know, and they get a little kickback every time the patient gets sent for those procedures. So are all those procedures really necessary? A lot of those procedures make us sicker instead of better. So that's why panels of doctors are going to get together and talk about these things and figure out what's the best practice for certain conditions, for certain times of life. You know, should you really be giving a colonoscopy to an 85-year-old woman who's got terminal cancer? Probably not. You know, I would think probably not. But if you're 60, and, you know, now it's, if you're 65, now it's going to be paid for under Medicare, and you should be able to prevent getting colon cancer. So that's kind of a, you know, a painful, difficult subject to talk about, but it's something that, you know, we need to deal with. A lot of us are getting older every day, and, you know, we need to know what we're prepared for.
What about our living wills? Don't they come?
So living wills are, you know, not everybody has them. A lot of people don't have them. And a lot of, you know, if you get sent to an emergency room and you don't have it with you, and you don't have a relative there, doesn't mean much, yeah. Even with my husband having it, there were procedures they did in the hospital when I wasn't there that I wouldn't have done. You know, I mean, nothing that saved his life, but I mean, they ended up giving him a tranquilizer pill that he had.
Well, I thought your doctor has got mine.
Should, but a lot of people don't have like a family doctor. That's another thing. Yeah, they don't really exist. And one good thing is there is a lot of money in this law to increase family physicians, to increase especially in rural areas. There's going to be a 10% surplus through Medicare paid for doctors who agree to set up a family practice in a rural area. So like someplace like Susquehanna County, Bedford County, those places should benefit from something like this. There's more money for community health centers, and there's definitely an incentive for doctors, for patients to try to have what's called they're calling it now a medical home. Used to be it was your family doctor. Now they've got a fancier name for it, a medical home. But it makes sense because a lot of us see specialists. You know, like my husband was seeing a cardiologist and a neurologist. And they did talk to each other, but basically it was the family doctor that had to kind of pull them all together. So it's important. You're right, your family doctor should have that living will. This healthier bill is going to help people of all ages. It will especially help children, adult children, and as we progress further into it, and up to 2018, it's going to help more and more Americans be covered with good insurance. Thank you. Yes. A lot of good things in this law, and if you have any more questions, you can relay them to Dave, and he'll relay them to me, and I'll get you an answer. Thank you very much for listening. You got pictures, right?
Yep.
Well, we thank you, Allison, for coming
Sure.
and spending your evening with us.
You're all right.
I hope it was educational to some.